Hi, and welcome back to another science video. In this video, we will be looking at the malaria vaccine, known as the mosquitoes, or RTSS, which, as of the 6th of October, 2021, was approved by the World Health Organization. Please leave a like and subscribe if you want to see more content like this. First of all, how is malaria transmitted? Malaria is a deadly disease and is normally transmitted by a previously infected, female, Anopheles mosquito, which is the only known transmitter of malaria. The mosquito gets infected by biting another person and drawing their blood, which already contains the parasite. Then, when the infected mosquito bites a healthy person, this person can then become infected. This is also the reason why mosquitoes are called vectors in transmitting diseases. The disease does not come directly from them. They must first become infected by other means before having the ability to transmit the particular disease. People who get malaria often get high fevers, shaking chills, and a flu-like illness. There are 4 types of the malaria virus which have been known to affect humans. These are the P. falciparum, P. vivax, P. ovale, and P. malariae. There is also the P. knowlesi, which is a type of malaria that affects macaques, a type of forest-dwelling monkey. This type of malaria is transmitted from animals to humans, known as zoonotic malaria. The P stands for Plasmodium. However, it is the Plasmodium falciparum type, which is the most likely type to lead to a serious infection and, if not treated, death. Despite being a lethal disease, normally, illness and death from disease can be prevented. There are about 2,000 cases of malaria in the United States of America annually. Most of these originate from tourists and immigrants coming from countries where malaria is much more prevalent, like parts of Africa and South Asia. According to the World Health Organization, in 2019, it was estimated that approximately 229 million cases of malaria were contracted, and out of these, around 409,000 people died, leaving a death rate of just under 0.2%. While this may look small, it should not be forgotten just how easily malaria can spread. Also, there are a number of factors based on the individual that determines how they will handle this disease. For example, most of these deaths come from poor children in Africa. This is because children tend to have weaker immune systems as compared to adults, and these children do not have as good access to healthcare. The rampant disease on these poor nations further exacerbate these poor countries' financial problems too. No doubt scientists have worked towards creating a vaccine to combat it, and hopefully save hundreds of thousands of lives. In the year 2002, scientists had succeeded in sequencing the P. falciparum genome, the genome which leads to the most deaths. Sequencing this had allowed researchers to make strides to know how to effectively target the disease. In the past, many efforts have been made to combat this virus. For instance, quinine is a substance gotten from the bark of a cinchona tree. It has been known to be quite effective against malaria since the 1600s. Additionally, the use of insecticides to kill the Anopheles mosquito and the addition of bed nets when sleeping has helped reduce mosquito bites and thus the spread of the malaria disease. In 2010, deaths from the disease fell from 755,000 to 655,000, a drop of 13%. That same year, cases fell from 223 million to 216 million. Despite doing all this, the number of cases of malaria is still high. Why is this? Basically, survival of the fittest. The malaria virus has been around for incredibly long. When some drug is used to combat the disease, the parasites which are resistant to the drug survive, and thus, these are able to reproduce. So, over time, only the parasites with the resistances to the drugs will survive. They become harder to kill. So, of course, the best solution would be to create a vaccine for malaria. In creating the vaccine, scientists must first determine which stage of the life cycle of the Plasmodium parasite to target, or whether it would be necessary to target multiple stages. Malaria is different than other diseases because you can get infected more than once, though the second time is more likely to be less severe. This is also why cases among children are so severe, and why tourists visiting countries where malaria is prevalent need to be careful, since they have never contracted the disease before. The way the RTSS vaccine works is that it triggers the immune system to respond to the first stages of the Plasmodium falciparum malaria parasite when it enters the host's bloodstream through a mosquito bite and infects the liver cells. The vaccine prevents the parasite from infecting the liver, where it can mature, re-enter the bloodstream to infect blood cells, which would then lead to the disease symptoms. After many years of trials and testing the vaccine, it was finally approved by the World Health Organization and will help save countless lives. Thank you for watching this video. If you found it interesting, please consider leaving a like and subscribing. Please have a great rest of your day.